I'm here with Dr. Eileen Paniagua, a new academic advisor in CalSouthern School of Behavioral Sciences. Dr. Paniagua, I wonder if you could tell us a little bit about your background and how you came to join the team here at CalSouthern.
So I am a clinical psychologist, licensed clinical psychologist in the state of California. Initially, I became a psychologist in Costa Rica, which is my country of origin, where I did my undergraduate studies and graduate, and got my licensure. For me, it was a very important moment there because I had the opportunity to do a big research project with the community, and it kind of changed my life. And so, although I'm a clinical psychologist, I'm also a researcher by nature, and that kind of motivated me to continue with my education and pursue a doctorate. And once I completed that here in California, I've been fortunate enough to go into different fields, I've had experience in forensic psychology, also health psychology, neuropsychology as well. So a ton of clinical experience. However, being in the academic world was always part of what I wanted to do from early on in my career, because I used to teach also graduate level courses, and I really truly enjoyed it. So it always stuck with me that I wanted to teach or do research, be involved with students somehow. So after a while of being only clinical, in the clinical field, I decided it was time to search for opportunities that would allow me to pursue that.
You mentioned your interest in academic research and writing. Could you elaborate a bit on that?
I had a tremendous opportunity to do this research project, part of my dissertation, back in Costa Rica, and it really started because from a very young age, I've always been really passionate about writing, telling stories, and I've always had a very curious mind. So when it came time for that, to meet this requirement, to do this research that I could make my own, at the time I was reading about a topic that really intrigued me, which is psychoneuroimmunology. And essentially, in very simple words, what it is the relationship between our mind, our psychology, and our physical body. So at the time, we had a significant health problem in our country, which was breast cancer. The incidence and prevalence was very high, and treatments seemed like weren't very successful. So it just ignited my curiosity as to, wait a minute, what is going on here? What are we not looking at in our healthcare field? I think there's something to it. So it truly came from a place of curiosity, and I went ahead with this project. And to summarize the outcome, it had a tremendous impact, to the point that today, with the pilot treatment model that we designed based on our findings, the public hospital, is implementing this treatment because of the positive effect that it had on patients with breast cancer. So that alone changed my life. And I said, there's something that as individuals and as psychologists, in my case, we can do to change the way we do things, the way we look at health, the way we treat people, the way we health and touch lives.
We have a number of different resources and cohorts available regarding academic writing, specifically for those students in the PsyD program. You're introducing another cohort devoted to academic writing. Could you explain to us a little bit about what makes it different?
The initiative with the Research and Scholarly Writing group came in collaboration with Dr. Grimes, who is our Dean of Behavioral Sciences Department, a School of Behavioral Sciences. And the idea is to make our research within the doctoral program in general more robust and improve it. We're always coming up with ways and ideas at CalSouthern to improve how we service our learners and the quality of the education we provide. And at that level, at the doctoral level, I think the standard should be high. And in providing that, we need to also help our learners to be equipped with the skills and resources that they need. So it's not just, we want you to do this, we want you to do these projects or these assignments, we want you to try to publish, is we are helping them to learn and to show them the way of how to do it, to enhance and create a collaborative community of research, not only to offer back that high standard, that education that the doctorate offers, but also to hopefully have an impact in the community. The difference about this group is that it's open to all learners from in the doctoral program from any level. So the idea is to assist them, whether they're in a course trying to do their research assignment, or if they're in the doctoral project, and offer them tools that can be helpful all throughout.
You've mentioned that it's important for students to think beyond the paper when approaching a writing project. Could you explain what you mean by that?
I've had many learners that I work with earlier in their program say, well, do you guys support research? I've always wanted to try to get published, or I'm interested in this topic. Do we get support for that? And so scholarly research and writing can be intimidating, but it doesn't have to be. And that's my whole point. It doesn't have to be daunting. It doesn't have to be boring or consuming or intimidating. If you have the right support, oftentimes they just need to push themselves or have somebody give them that motivation. And my idea of beyond the paper is look at it creatively. Look at it as something that means something to you. So when people do research, I try to always recommend or, and motivating them, say, pick something that means something to you. Because it's going to be, it is a lot of work, but it can have a huge impact. And in the field of psychology, I've seen that it can. It can modify treatments, it can modify the way we look at things, the way we look at health. Medicine is an evolving field, and we are active contributors to that. So I want learners to think that way and to realize that what they write, what they do, what they put out there does have an impact, and that's why it goes beyond just a paper.
Dr. Paniagua, thank you so much for joining us today.
Thank you.